Good morning. My name is Asabatwa. Today I give a presentation on a tibia bone. Introduction. The tibia is the medial and larger bone of the leg. It is homologous with the radius of the upper limb. Side determination. First, the upper end is much larger than the lower end. Second, the medial side of the lower end is projected downwards beyond the rest of the bone. The projection is called the medial malleolus. Third, the anterior border of the shaft is most prominent and crest-like. It sinuously curves and terminates below at the anterior border of the medial malleolus. Feature of the tibia bone. Upper end. The upper end of the tibia is markedly expanded from the side to side to form large and condyle which overlay the posterior surface of the shaft. The upper end includes the first medial condyle, second lateral condyle, third intercondylar area, and fourth tuberosity. Shaft. The shaft of the tibia is a prismoid in shape. It has three border: anterior border, medial border, and interosseous border. And it has also three surfaces: lateral, medial, and posterior. Lower end. The lower end of the tibia is slightly expanded. It has five surfaces. Medially, it has prolonged downwards as the medial malleolus. Attachment on the tibia. Attachment on the tibia condyle, medial condyle includes semi-membranous capsular ligament of the knee joint and medial patellar retinaculum. Attachment on the lateral condyle. It includes iliotibial band, capsular ligament of the superior tibiofibular joint, extensor digitorum longus, and tendon of popliteus. Attachment on the intercondylar area, interior cruciate ligament and posterior cruciate ligament. This slide shows the posterior aspect of the right leg, highlighting the important bony landmarks and muscles and neurovascular structures attached to the tibia bone. Attachment on the tibia. Attachment on the tibia, tuberosity, ligamental patella. Attachment on the shaft, tibialis anterior and sartorius and gracilis and semitendinosus. Soleal line give attachment to the soleus, facial covering popliteal and transverse fascia septum. Flexor digitorum longus and interosseous tibiofibular ligament, capsular ligament of the ankle joint. These figures show the posterior aspect of the tibia. The posterior surface provides attachment for the serval muscle of the leg and continued important anatomical landmarks. Anatomy. The upper end of the tibia is one of the commonest sites of the acute osteomyelitis. The knee joint remains safe because of the capsular it attaches near the articular margin of the tibia, proximal to the epiphyseal line. The tibia is commonly fractured at the junction of upper two-thirds and lower one-third of the shaft. As the shaft is most slender here, such fracture may unite slowly, or may or not unite at all. The blood supply to this part of the bone is poor. This may also be caused by tearing of the nutrient artery. Forward dislocation of the tibia on the talus produce a characteristic prominence of the heel. This is commonest type in injury of the ankle. Thank you.